Hey everyone, welcome back to the channel. It's so good to see you again. And if you are new here, I am Brian K. Dorsken from Greenworld International Company. And to all my returning viewers, thank you for coming back. And let's jump right in. So today we are going to learn about Greenworld Herbs Toothpaste. Today I'm going to start by asking you a question. How do normal teeth and normal gums look like? So how do normal teeth and normal gums look like? And as you can see there, the healthy gums and the healthy teeth, they look very nice. So as you can see the structure of our teeth, the purely white visible part of the tooth is the crown, and the longer portion anchored inside the gum of the bones is the root. The purely white visible part of the tooth is the crown, and the longer portion anchored inside the gum and the bone is the root. The outermost hardest white cover is known as the enamel, and the inner relatively less hard part is the dentine. It surrounds the pulp containing blood vessels and nerves of the tooth. Teeth are embedded in the jawbone, which is covered from outside by a specialized layer of the skin called the gums or the gingiva. Healthy gums are generally pink in color and stippled like orange peel. They are firmly attached to the underlying bone. Diseases affecting teeth and mouth. We have dental caries. We have the gum disease. We have ulcers in mouth. We have white patch in mouth mucosa. The common oral diseases affecting the teeth are the dental caries and its complications. And the common oral diseases affecting the gums are the gingivitis, that is the bleeding gums, and periodontitis. And what are the common oral diseases affecting oral mucosa or the linings of our oral cavity? We have oral cancer and white or red patches. And another common oral disease, we have broken teeth and jaws. What are the symptoms of dental caries and the complications? So symptoms of dental caries, we have brown and black spot, that is discoloration. We have hole or cavity on the tooth or in between two teeth, broken teeth. We have sensitivity on consuming hot and cold food. And also we have food lodgement on or in between teeth. Tooth pain on touch or on bite. We have acute intolerable pain, and the complications, if left unnoticed, we have abscess formation, we have pus discharge, there is also swelling, and also fever. And what are the causes of dental caries? We have consumption of sweet and sticky food, accumulation of bacteria, food left on teeth or in between teeth for long time. And we have also progression of dental decay. You can see this deep brown or black spot or cavity on the tooth. It is a smaller one, and then it continues to progress into deepening of cavity to involving inner layer, causing sensitivity. And then also a progression continues to decay, extending into the pulp, causing severe pain. And we want to also look at tooth decays affecting children or baby teeth. We have rapid destruction of multiple baby teeth, and you can see in the picture that do not let the baby sleep with the milk bottle in the mouth. And also for a small child up to 3 years of age, they should use rice size toothpaste, a small size of toothpaste similar to the size of a rice, a very small size. And for children up to more than 3 years of age, they use a pea-sized toothpaste. Not too much toothpaste, just a little, a pea-sized toothpaste. Those are for children more than 3 years of age. And we want also to look at what is nursing bottle caries. It is seen in babies on bottle feed. It involves rapid destruction of tooth structures, most commonly affects upper front and lower back teeth. Lower front teeth are spared as they are covered by the tongue during feeding. Symptoms and signs of nursing bottle caries: we have early loss of milk teeth, difficulty in eating, unpleasant appearance, pain and dental abscess, delayed eruption of permanent teeth. And how do you prevent nursing bottle caries? Do not let the baby sleep with sweet nipple or milk bottle in the mouth. Last drink should always be water. Small babies should be given water as last feed before sleeping. Assist in brushing after first tooth erupts in oral cavity. Use rice-sized toothpaste for up to 3 years and pea-sized toothpaste for more than 3 years children. Avoid use of sweetened milk, cola, citric juices, sticky and sweet food. Now we are going to look at the diseases of the gum or gum diseases. We have bleeding gums or swollen gums, also known as gingivitis. And if gingivitis is not treated, it may progress to a severe stage, causing loose teeth and abscess formation. That is the formation of pus. And what are the common gum diseases and prevention? The gum diseases are caused by poor oral hygiene and plaque accumulation, leading to inflammation of gums. If plaque is not removed regularly, it may harden to form a calculus. Common gum diseases are bleeding gums or gingivitis, advanced or severe stage of gingivitis, that is periodontitis. And how do you prevent? You rinse mouth with water. Maintain oral hygiene with toothbrush at least twice a day. Avoid picking teeth. Patient having diabetes, heart diseases, or any regular medication will require extra precaution for dental treatment. Pregnant mothers also need referral to dentist. Visit to dentist for expert dental opinion. Now, what are the complications of gum diseases? We have foul odor from the mouth or bad breath, deposits on teeth, bleeding from gums, swollen gums, dull constant ache, we have loose teeth, gaps in between teeth, loss of teeth, and gum abscess. But you can also see the irregular alignment of teeth. We have the normal alignment and the irregular alignment of teeth. And irregular alignment of teeth or jaws, it is also called malocclusion. Any deviation from the normal alignment of teeth, that is, in upper or lower jaw, it may compromise the appearance or the functions like speech and chewing. Causes of malocclusion or causes of irregular alignment of teeth, we have early loss of milk teeth due to dental decay, oral habits causing abnormal pressure on teeth and surrounding structures such as thumb and finger sucking, tongue thrusting. Signs and symptoms of malocclusion: abnormally forward or backward teeth or jaw, gaps between the teeth, uneven crowded teeth, difficulty in keeping teeth clean, cross bite or reverse bite, asymmetry of face, pain in the joint between upper and lower jaw, difficulty in pursing lips, unpleasant appearance, and you can also see that lost teeth are replaced with complete or partial dentures, missing tooth or teeth. The jaws without teeth are called edentulous. Partially edentulous when a few teeth are missing from either upper or lower jaw. Completely edentulous is when all teeth are missing. Signs and symptoms: we have missing teeth, inability to chew, difficulty in speech in case of missing front teeth, unpleasant appearance, and compromised smile. What you should do is to seek advice for artificial dentures, which aids in replacement of missing teeth. It can be removable or fixed, complete or partial. Dentures should be removed at night before sleep. Keep the dentures in water and clean them. And we want also to see patches in the mouth and oral cancer. White and red patches in the mouth are not a good sign. An unhealing ulcer on a patch is considered dangerous. Some patches are not dangerous. Those are the points to note. Patches in the mouth could be oral premalignant lesions and oral cancer. Risk factors: we have bottleneck or smoke less or smoking tobacco consumption in any form. Long-standing irritation due to sharp teeth and faulty dentures. Frequent and long-standing alcohol consumption. And advise brief intervention for quitting tobacco, betel or such products. Delay the consumption of tobacco. Distract or divert the mind from tobacco towards any other activity like music, reading, or conversing with friends. Drink water frequently and keep the mouth wet to reduce the craving for tobacco. Deep breath or do exercise to control the cravings. What are the symptoms? We have long-standing, non-healing ulcer for more than 2 weeks, a white or red raised patch in the mouth, restriction in mouth opening, a lump or growth in the mouth. difficulty in chewing or swallowing, reduced mouth opening, burning sensation in the mouth, sudden change in voice. Fungal infection of mouth, that is candidiasis or oral thrush. Most common fungal infection of the mouth is candidiasis, also called oral thrush. Causes of fungal infection: neglect of oral hygiene, continuous use of antibiotics or steroids, dry mouth, immune compromise, difficulty in swallowing or chewing, ill-fitting denture, use of inhalers by asthmatics, chemotherapy or radiotherapy. In cancer patients, signs and symptoms: burning sensation or pain, cracked corners of mouth, foul odor, difficulty in swallowing or chewing, altered taste, whitish curd-like patch. What are the advice to give on fungal infection? Advice on discontinuing the use of ill-fitting or faulty dentures, correction of dentures, rinsing with salt water, toothbrushing, advice on consumption of more water, and keeping mouth wet. Trauma to face or teeth. Broken tooth or knocked out tooth, bleeding, numbness or pain, wounded and swollen lips. Trauma to face or teeth causes playing, cycling, running, physical violence, sports injuries, falls. Actions to be taken: arrest bleeding with pressure or cold pack. Save the knocked out tooth or broken tooth fragment and place it in milk or water or tender coconut water. Visit to the nearest dentist within 1 hour. If the injury involves face or head, refer to the nearest health facility immediately. Caries causing food. We have sweets. You can see the cakes there and many other food. And what are cariogenic food? Cariogenic food. Dietary habits can influence teeth during and after development and eruption. Poor oral hygiene along with consumption of cariogenic diet like chocolates, toffees, biscuits, cake, and sugar-sweetened beverages like cold drinks leads to development of dental decay. Refined sugars are the main diet factor for tooth decay. Frequent snacking in between meals also lead to dental decay. How do you brush your teeth? We have up and down strokes, also back and forth strokes. Brushing your teeth. Brushing must be done twice a day. This is an important part of effective plague control. A pea-sized amount of toothpaste and a soft bristled brush must be used. 2 types of toothbrushes. Baby adult brush may be used according to the age. Milk teeth also need to be brushed and maintained in good health since this prevents premature shedding. The toothbrush has to be changed once in 3 months or when it begins to fray. Massaging the gums with fingers should also be advised after toothbrushing. Brushing strokes up and down. Tongue cleaning and mouth rinsing. How do you clean your tongue? And how do you rinse your mouth? Tongue cleaning. Clean the tongue after toothbrushing. It can be done with the bristles of the brush by applying gentle back and forth strokes. Rinse the mouth regularly after brushing. Mouth rinsing. It is a part of routine oral hygiene. Rinse your mouth thoroughly after each meal. Mouthwashes can be used after consultation with the dentist. Choosing your cleaning device. You can use toothbrush, toothpaste, and also floss, dental floss. How do you choose your cleaning device? Toothbrush. Two types of toothbrushes, baby or adult brush, may be used according to the age. It should be changed once in 3 months or when bristles begin to distort. Toothpaste. Toothbrushing should be done with a toothpaste. A pea-sized amount of toothpaste should be used. Tongue cleaner. It can be done with the bristles of the brush by applying gentle back and forth strokes. And now 5 key messages for healthy teeth and gums. Take care of baby teeth. This laid the foundation for successors. Oral hygiene is key to a healthy teeth and gums. Avoid caries causing food. Tobacco, that is smoking and or chewing, and betel nut are risk factors to oral cancers. Teeth are for lifetime. Take care. The benefits of World Herbs Toothpaste. World Herbs Toothpaste. The products provides all-in-one dental care, refreshing and whitening your teeth. Activates blood platelet, promotes platelet aggregation, and restrains bleeding quickly. Promotes the generation of basic fibroblast growth factors and vascular endothelial growth factors. Accelerates blood capillary growth and connective tissue proliferation. Heals the bleeding wound surface, thus preventing further pathological changes. Improves the phagocytosis significantly and enhances the anti-pathogens capability of oral tissues. Counteracts inflammations caused by multiple inflammatory agents and alleviates swelling and fester caused by inflammatory exudation. Improves microcirculation of blood capillaries. Suggested use. Use World Herbs Toothpaste to brush your teeth at least twice a day or follow doctor's advice. For people with oral ulcer, gargle with toothpaste for 2 to 3 minutes after toothbrushing. Children under 6 years should use it under adults' instruction. The dosage is about a pea in size. And remember, it comes with 1 free toothbrush. That's it for today. Take care and peace out. Catch you next time. And if you enjoyed watching the video, make sure to like, share and subscribe. See you in the next one. Bye bye.